download our app available from the App Store and Play Store.
Hello and welcome to Medical Dialogues. I'm Mr. Zaman. Let's look at today's daily bulletin. Setting aside the order of the State Commission which held a Punjab-based hospital guilty of medical negligence while performing open reduction and internal fixation or ORIF on a patient, the National Consumer Disputes Redressal Commission or NCDRC gave clean chit to the hospital. Although the patient had alleged that he had to suffer disability because of non-union of bones, the top consumer court opined that non-union of malunion or fracture is a known complication which could arise by improper follow-up, weight bearing or infection. The disability was not due to the negligence of treating doctor or hospital. With an aim to curb quackery, Telangana State Medical Council has set up 3-member committees in every district across the state. This information has been provided by the Registrar of TSMC while responding to an RTI query raised by the President of the Healthcare Reforms Doctor Association. In the letter dated April 19, 2023, the Council informed that these district committees will comprise the DMHO, the President of Indian Medical Association and a doctor from the government side. The Council has further mentioned that these newly constituted 3-member committees are trying their level best to control quackery. Bringing good news to the medical aspirants in Andhra Pradesh, the Medical Assessment and Rating Board of National Medical Commission has given its nod for 150 MBBS seats at Government Medical College in Eluru. The Apex Medical Education Regulatory Body NMC has permitted the state to commence the MBBS admission in 150 seats at the medical college from the academic year 23 to 2024. This comes after an inspection was conducted by a team from NMC who visited the college and took stock of the infrastructural facilities, including the faculty needed to start the college on Wednesday. Through a recent notification, drug price regulator, the National Pharmaceutical Pricing Authority or NPPA, has revised and fixed the ceiling price of the 8 IV fluids with packages having special features of Schedule 1 under Drugs Prices Control Order 2013. New research indicates that for patients with advanced skin cancer, it may be important to maintain normal vitamin D levels when receiving immunotherapy medications called immune checkpoint inhibitors. The findings are published by Wiley Online in Cancer. Vitamin D has many effects on the body, including regulation of the immune system. A new study led by investigators from Brigham and Women's Hospital assessed more than 3,000 adults from a Mediterranean population, examining the relationship of siestas and siesta duration with obesity and metabolic syndrome. The researchers found that those who took siestas of 30 minutes or longer were more likely to have a higher body mass index, higher blood pressure, and a cluster of other conditions associated with heart disease and diabetes compared to those without siestas. However, for those who had short siestas, also known as power naps, this increased risk for obesity and metabolic alterations was not present. In contrast, short siesta takers were less likely to have elevated systolic blood pressure than those who took no siestas. Months after COVID-19, previously infected people with persistent neuropsychiatric symptoms had abnormal brain activity during memory tests, with less activity in brain regions normally used for memory tasks, but more activity in other areas of the brain, according to new research published in the online issue of Neurology. Despite these changes and the ongoing complaints of problems with memory, concentration and fatigue, people who had COVID-19 had cognitive test scores similar to those who never had a history of COVID-19. However, people who had long COVID had greater brain activation on a working memory task compared to people without prior COVID-19 infections. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.